Since Joy was born, it has been demanding. She was born with a syndrome called Klippel-Feil syndrome. It has been stressful. It's been multiple doctor's appointments, therapies. But you take it one day at a time and prioritize things and get through it.
Now I don't hurt it anymore.
Right, you're doing great with your back. We've been talking
Our pediatrician, our regular pediatrician, Dr. Suda, recommended that we see Dr. Mazzola.
I went backwards.
The Goryeo Children's Hospital has a wonderful reputation in the community. I get a lot of phone calls from patients asking what we do and if we can help. And I try and collect as much data as I can from the families and their providers, and I get them scheduled to meet our team.
We see kids with any kind of neurological or developmental problems. So we see children with cerebral palsy, spina bifida. We see children who've had brachial plexus injuries, children who've had strokes, children who've had brain trauma. All sorts of different things have happened to these children over the course of their life to affect the way they move. So very often the way I help the child is by doing a surgery, but I also introduce them to my friends who do orthopedic surgery, my friends who do physical therapy, occupational therapy, my friends who make the orthotics. Kids with complicated problems need to go to a group of specialists who know what they're doing and function in a collaborative center type of fashion where they can provide all the care a child needs in one place.
When we get together as a team here, we're looking to find the perfect answer for the patient. And the perfect answer is going to include input from all of our various team members.
Do you see where Snow White is? Oh, not with your hands, silly goose. You gotta use your feet. When children come in to therapy in general, it seems a little daunting or overwhelming for them. So if we can assess them in a way that appears to them as playing, we're gonna get more out of them.
You have to be blowing bubbles and be animated and have fun with the children so they have your trust. They're not going to walk down the hall for you if they don't feel comfortable. They're not going to try and do different things for you if they're not comfortable. So you make it fun and interact with them and maybe just being silly to get them to, to really assess them and see what they're doing.
A lot of these parents and the patients have seen multiple specialists, and obviously the parents would like the best for the children.
PT at school had referred him to someone, but
what we are able to offer is first analyze what treatments have been offered, and whether certain treatments have not been offered, and as a team, whether those treatments would be beneficial to the children.
I look at the patient from an orthopedic perspective. So while, some of the others are thinking, well, how are the nerves working? How's the brain working? I'm saying, okay, yes, we've got some nerve issues, some brain issues, but what is it doing to the muscle, to the bone? And what are the pitfalls this patient could have that I need to take control of from a young age so that they get the appropriate intervention from me at the right time?
I'm a pediatric rehab physician or pediatric physiatrist. And my job is to really look at the kids from a non-surgical, functional approach, working closely with the physical and occupational therapist. A lot of times our goal is to avoid surgery unless absolutely necessary for as long as possible for a lot of these children.
He does have tethered spinal cord.
Sean is a guy with spina bifida. He's adorable. And he had a little bit of difficulty with the placement of one of his feet, secondary to just the spina bifida and then the muscles not working as they should. He got a little stuck in a bit of a tight position. So when we sat down in a room together, Dr. Minkowitz and I decided, why don't I do Botox, which is an injection into the muscles that we think are tight or that are causing the foot to turn or not sit in the right direction. And then we were going to send him over to Dr. Minkowitz to see if he still needs to be casted to help really hold that foot in the right position for an extended period of time.
The goal is to decrease spasticity because spasticity over time can cause pain. The patients, they may have significant limitations in their ambulation. We have got patients after they have had a baclofen pump in place who are unable to walk, who are now able to take a few steps and can walk independently. I had a patient who was born at the hospital, had severe brain damage and developed cerebral palsy. I've been following him since birth, and I know these parents. He had tried all the other options, and after the pump, within a few days, the parents had reported that he was able to take a few steps with assistance, which he had not done ever. It was very gratifying, both for the parents because they have gone through a lot, and at the same time for the child.
Let me just see on the sagittal if there's anything.
I love
there.
being part of this team. All of us sitting there collaborating together. Everybody's there just to do what's best for the children or the patients that are coming in.
Let me help you, okay?
All right. So this is going to go around your body.
Is it gonna hurt?
No, not at all.
The work that I do at the clinic is to design, fit, and fabricate all sorts of orthotic and or prosthetic devices. Mostly in the clinic, we're seeing patients who need something to support or modify an existing body part or to protect a body part.
Guess what?
What?
I think Dr. Mazzola's personality and her love of children, and that she would make Joy and us feel very comfortable. So I think that was a big part of the reason that Dr. Suda wanted us to see her.
Yes, you did, Miss Joy. I first met Joy when her pediatrician called me and said, Kathy, I have a little girl, a patient, and I know there's something wrong with her, but no one has been able to tell me what's wrong with her. And she told me some of the things that were going on with Joy. So I ordered a number of different tests, and I asked Joy's parents to please bring her into our center here, because I knew that because of Joy's medical and neurological issues, it was important to see the whole team, because a child with special needs or multiple issues benefits from this kind of center. When you do the MRI, that's when you can see she has a tethered spinal
Between
column.
them listening to my input and my husband's input and all the doctors that are there, that we come up with what really does need to be done and in what order it needs to be done. So it was frightening, but definitely reassuring by the time we left of that this, doing the tethered cord surgery was really the right first step.
We decided to do the most simple procedure first in hopes that that would prevent the need for any additional surgery. You do it on you, and I'll hold it on him. Okay?
As we were going in for the surgery and we're going to put her under anesthesia, we had a teddy bear with a mask, just like she was going to put on, and she put on the teddy bear. So, really made her feel, I think, empowered that she could do it, to the teddy bear, so she could have it done to her. Whenever your child is a little more at ease, of course, you as a parent are more at ease.
The one above it, because right here is where that little hemivertebrae is. When I take a child into the OR and I see the tears in the parents' eyes, I know how they must feel. I mean, I have 5 kids, so, I will tell them that, what? While the child's in the OR, they are my child, and I will treat them like my child. When I bring them back from the OR, they go back to being your child. But don't worry, while they're in the OR, they're like my child. This is called sectioning of the fatty filament.
We were kept up to date, about every 45 minutes as to how everything was going. And eventually, she was out, and we were brought right in and got to see her.
You want to get up? We're gonna have to stay.
It was good that everyone got to see Joy before surgery, so that everyone can see her progress after surgery. And then if in the future, as she grows up, if she needs an additional surgery, we'll all be on the same page. We'll all have known Joy.
No, I don't. Could you set it for me?
Oh, you're playing with fire up there.
Oh, yeah!
Joy's doing great. She is back at school.
Good. Hold her.
Her therapy has changed a little bit. It's more geared towards post-surgery and making sure that we re-strengthen the areas that she lost some muscle tone and some flexibility in. But she's doing really well, and just I think she's really looking forward to the summertime and being able to get down to the lake and go swimming.
Our goal is to make the child as independent as physically possible, and everyone has limitations. You have limitations, I have limitations. Some of these children have way more limitations than we'll ever have, but our overall goal is to help that child move better and to make it easier for them to navigate the world around them.
Joy loves all of the doctors and everybody that works in the office. She just wants to hug them all because they make her feel really great.
My dear, nice job, my dear. You did a good job, girlfriend.
You are super tickled. Every child has a story, and it's an honor for me to get to know each child and their family and their story. If there is a way that I can help that family or that child, that's what I love to do. You're very welcome.